Diagnostic pillars in Chinese medicine. So let's start with number one. What term is used for the systematic approach Chinese medicine uses to gather diagnostic information? Answer.
Number one.
Number one.
Which of
Diagnostic.
diagnostic pillars? Which of the following senses is not part of the wait.
Four.
I think okay.
Four.
Yeah. Which of the following is not part of the four diagnostic pillars?
Four. Smell.
Taste.
Oh, yeah.
Taste.
Oh, taste. Number two.
Taste.
Sorry. So it's observation, that's the eyes, right? Then we have the smell, that's the olfactory, the hearing, that's the what else? We don't use the taste. What does a deviation from the norm represent?
A manifestation of an imbalance in physiology, number one.
Imbalance. When we say imbalance, it doesn't necessarily mean that your laboratory results will be positive, no? That's where we come in very, very useful. Number four, which factor does not influence what is considered a norm or midpoint?
Planetary alignment.
Commonality of the sign is equivalent to normality. It's the correct stance.
Number
Does
three,
not
common
make a sign
doesn't.
normal.
Yeah, common does not make a sign normal. Okay. Which diagnostic pillar is highlighted as indispensable?
Tongue diagnosis.
Tongue diagnosis, that's why we all have to study it, no? Because if we do not do tongue diagnosis, you do not have the capacity to practice. In fact, yeah, so we need to really work hard on improving our skill. A stable roof is compared to a diagnosis. How many pillars support a stable roof?
Four.
Which of the following best describes the view on weighting diagnostic signs?
Number two.
Yes.
Weighting evolves with
Practitioner experience. Why might a Japanese acupuncturist place more emphasis on palpable signs?
Number one.
Because Japanese traditional values touch more than sight.
Yes. Number 10. What is the relationship between norm and reality in diagnosis?
Reality is an aggregate of deviations from the norm.
Which of the following statements reflects the perspective on memorizing signs and symptoms?
Understanding underlying mechanisms is more valuable than rote memorization.
Yes, understanding is more valuable. What does the concept linear movements away from a midpoint refer to?
Direction of physiological deviations.
Which diagnostic pillar does a 5-element acupuncturist likely prioritize?
Smelling and listening.
The diagnostic process is blank despite the objective nature of signs.
Is subjective.
Objective. What is the primary danger of focusing too narrowly on an initial diagnostic thesis?
Missing alternative interpretation of signs.
Correct. Which of the following is not a factor that can cause a norm to vary?
Blood type.
Yeah. The metaphor of a roof is used. Which element of the diagnostic system does the roof represent?
The final diagnosis.
Okay. Correct? Yeah.
Yes, correct.
Which of these statements best captures the view on common tongue appearances?
Pale,
Number
swollen
2.
tongue with teeth marks is a common manifestations of imbalance.
So definitely it's not normal, diba? So
Yeah.
you see this very commonly. What is the most reliable way to learn diagnostic significance of physiological changes?
By understanding how and why changes arise.
Number 2, which pillar is described as cornerstone alongside the other?
False diagnosis.
Yes, false diagnosis. Which of the following best illustrates the stance on key symptoms?
Number 2. Labeling any symptom as key is avoided.
Correct. The phrase context that the object is observed in provides a definition most directly supports which diagnostic principle?
Holistic interpretation of signs.
What is an indispensable aspect of the diagnostic columns?
Tongue and pulse
False
diagnosis.
diagnosis.
Indispensable. You cannot do without this. So if you are a
Okay.
practitioner and you do not do this, well, you have to study.
Tongue and pulse.
So I don't sell the yeah, so we need to exert more effort, diba? So I hope you're all enjoying a review on tongue. Okay. Which of the following best captures relationship between modern Western medicine and Chinese diagnostic approach?
Western medicines narrows focus while Chinese medicine broadens it.
Yes, number 2, correct. Which of the following is a correct question a practitioner should ask themselves when observing a patient?
Number 1. What
Yes.
should I expect to be seeing, hearing, smelling, or feeling right now?
Okay, so you're like a dog. Sorry, I'm kidding. Or, yeah, you have to make your senses active, diba? Okay, sometimes it's the smell will already give away the diagnosis. Each norm or midpoint is, of course, itself variable. Which of the following best exemplifies this statement?
Being wide awake at 3 o'clock in the afternoon, but not at 3 o'clock in the morning.
Yes.
Being wide.
You should be asleep. You should be having REM movement, rapid eye movement. Which diagnostic pillar primarily employs the practitioner's intellect?
Interrogation.
Interrogation.
This is what differentiates an intelligent practitioner from a dumb one, okay? Asking the right questions. Why might a practitioner's weighting of signs change over a 10-year period?
Number
Because
2.
the practitioner gains experience and shifts focus among pillars.
Correct. What is the consequence of neglecting any one of the 4 pillars?
Diagnostic
The diagnostic
becomes
group
unstable.
becomes unstable.
Yeah. And that makes you a dumb, stupid practitioner.
Oh.
Actually, we are starting a group, like we educate patients that they need to really feel their pulses. So at the same time, look at their tongue every day. So that next time they will only look for practitioners who know what to do with their tongue, diba? So, but I'm sorry, but we have to do that. We have to make people more discerning, no? So if you do not do that, then you're boodle, okay? Which of the following statements aligns with the view on common versus normal signs?
A common sign may still indicate an imbalance.
True. Which sensory modality is paired with the ears as a diagnostic tool?
Hearing.
Of course.
Hearing to.
Hearing. Which alangan naman? Smell. Which of the following best reflects the role of subjective weighting in diagnosis?
It is an unavoidable aspect of the diagnostic process.
Yeah, there are things that are difficult to teach, no? It requires years of experience talaga. Which of the following is not the purpose of the 4 diagnostic pillars?
To
Number
replace
3.
patient history entirely.
Yes. Did you know that the patient history is quite important, no? 70 to 80%. Which of the following best describes the recommended attitude while diagnosing?
Open-minded,
Yeah.
search for confirming evidence.
True, very correct. Every sign and every change is significant. Which diagnostic philosophy does this reflect?
Holistic.
Holistic. Which of the following is an example of a sign that is common but not normal?
Clear
Pale,
skin and
swollen
still
tongue with
bleeding.
teeth marks.
Pale,
Okay,
swollen tongue.
question. What does that mean? Can you tell me, Sir Joe Bell? What image
Pale,
comes into your head when you see that kind of tongue? Because you say it's not normal. So what is the pattern that immediately you immediately think of?
pale, swollen tongue. Chest stagnation
Oh, why just stagnation? Why are you fond of stagnation?
because of teeth marks beside
Oh,
side of
where
the
did you
tongue.
learn that? Oh my
Binding.
God, that did not come from lab. Can you, my gosh. Actually, when you do when you say cheese stagnation, you don't actually see anything. But this one is already, remember, the tongue is swollen. That alone is very abnormal, right? It's a
Dampness.
lot about yeah,
Spleen deficiency.
yeah,
Yeah,
G or
spleen
yang. Yeah,
dampness.
if it's yang deficiency, it there's cold. Yeah, so you don't
Pale,
Cold pattern. Cold pattern yun, Doc.
pale also blood deficiency.
yes, blood
Mm.
deficiency,
Pale.
but not really very swollen tongue. No, okay, so you will be thinking of yeah, blood is under the realm of yin, so you'll be looking at probably a dry tongue, very pale tongue, and swollen would mean that there is
Dampness.
dampness, yeah. So dampness, spleen qi deficiency, most likely. And if there's cold, that's spleen yang deficiency, especially when you have a very swollen tongue. And sometimes you have, you know, what you see on the tongue will definitely lead you to ask more questions that are very relevant. Okay, so please do not immediately say it's cheese stagnation unless you have symptoms to make it more validating, no? To validate your diagnosis. And okay, question. I think we took this up last time. So if a patient is in control of the interview, what is that? What does that immediately make you think of?
A heart problem.
Hmm?
Oh,
Cheese,
Shen.
liver cheese that in
Liver cheese.
control is the one controlling. Okay.
Of liver
In
cheese.
When
controlling
it's a heart issue, usually heart rate deficiency, he will not actually look at you straight in the eye. No?
Oh.
Yeah.
Ah, yes.
So
Yes, yes.
don't worry. Next time we will talk
Liver
about heart
cheese.
and small intestine. Are you excited?
Yes.
We'll run for two. Okay. And this is just an introduction. No? Okay. Why is it essential to use all the 4 pillars together?
Because a diagnosis is unstable if any pillar is missing.
True, very true. So even if using only one pillar will already make you think of the diagnosis, you still have to validate by, by performing the other pillars. Okay. Which diagnostic pillar primarily utilizes the practitioner's eyes?
Tongue
Tongue
and
and
complexion.
Of
complexion.
course, if you have eyes, you know what the answer is.
Tongue.
Most signs and symptoms can mean different things in different contexts. This highlights the importance of what concept?
Contextual analysis.
Contextual analysis.
Which of the following best captures the role of interrogative approach 10 years ago versus now?
It was more central 10 years ago and is now less emphasized.
True. Because we are so more rely so much on technology now, no? So I think you need to make a balance there. Which sensory observation is considered a cornerstone of its respective diagnostic column?
Tongue observation for the visual column.
What is the relationship between physiological changes and pathological processes?
Pathological processes cause observable physiological changes.
Correct. Which diagnostic pillar is most directly associated with listening?
Auditory assessment of breathing and
Breathing. You have to listen to the breathing and, of course, the voice. What is the effect of overwhelming the practitioner with information? Too many things to study.
It may intimidate, but is intended for training awareness of deviations.
Yeah, that's why we only meet twice a week, di ba? So much study will make you dumb.
No.
Which of the following best illustrates the view on objective science versus subjective diagnostic process?
Signs are objective, but interpretation is subjective.
The four pillars enable the practitioner to construct as precise and solid a diagnosis as possible. Which pillar is not listed among the four?
Radiographic.
Geographic imaging.
What is the primary reason for employing a systematic organization of diagnostic knowledge?
To increase diagnostic precision.
Of course. And that's what makes you a very good practitioner. Which of the following is described as a manifestation of an imbalance in their physiology?
A deviation from the norm in appearance, sound, or scent.
Okay. So first you should know how a normal tongue looks like and how a normal voice should sound like. It should sound like a bell. How a normal sound of a human being smell like, no? The diagnostic process itself is subjective. Which factor contributes most to this subjectivity?
Personal weighting of science by the practitioner.
Yes. Which of the following best captures the assertion about context in Chinese medicine?
Context defines the meaning of a sign more than the sign alone.
Which of the following is an example of a linear movement in diagnostic terms?
Gradual increase in tongue coating thickness.
Okay, what does that mean when the coating thickness increases? Are we having a patient that's improving or deteriorating?
Deteriorating.
Because that
The
means
pathological, is
the pathogenic, yes,
factor. It's
the duration, like how the duration of the problem, right? No, in pathogenic factor. The picture becomes more defined and precise when what occurs?
information is maximized and integrated.
Of course. Which of the following best illustrates the use of interrogative approach today?
Number 3, it's now balanced with visual and auditory.
True. Why are tongue and pulse diagnosis considered indispensable?
They are cornerstones that stabilize the diagnostic proof.
Okay. So from now on, if you see a practitioner not doing that, then you have to invite them to our review. Which of the following best reflects the relationship between norm and midpoint?
The midpoint is a variable reference point for the norm.
Which of the following best defines diagnostic pillars?
For sensor and intellectual methods of patient assessment.
Correct. Being common does not make something normal. Which example illustrates this warning?
Widely observed pale, swollen tongue with teeth marks.
So what immediately comes to mind? Like if you see this kind of tongue, what do you ask the patient right away? What is the first thing that you will ask when you are suspecting Qi deficiency? So that means lack of energy. Does the patient have fatigue? No? And also if it's spleen Qi deficiency, if the swelling is more on the center, right? You speak of, what is the number one symptom that you ask about spleen Qi deficiency? Loss of appetite. Okay? Basic. Basic. Which of the following statements aligns with the approach to learning diagnostic significance?
Understand physiological mechanisms behind signs.
That's why we're having this review, diba? And I'm very happy that we are increasing in number, although not that often. Okay, so the diagnostic process is comprehensive. Which factor contributes most to this comprehensiveness?
The integration of all 4 pillars.
Correct. Which of the following best captures the evolution of Chinese diagnostic methods over the millennia?
They have
They
grown
have
more coherent
coherent.
and logical.
Yes. Which diagnostic pillar is most closely linked to listening to the client? Repeat question.
Auditory
Auditory
assessment of voice
treatment and voice and breathing.
Which statement best reflects the warning about over-reliance on a single diagnostic pillar?
It can destabilize and diagnostic rope.
Why might? Because your mind is too close, no? So for example, if you see a swollen tongue, do not focus only on Qi deficiency, di ba?
Yes.
There are
Okay. Some.
Yeah. Where are we? Okay. Why might a practitioner consider the time of day when assessing a patient?
Because physiological norm can shift based on circadian rhythm.
Correct. Which of the following is an example of a visual diagnostic sign?
The color and coating of the tongue.
What is the normal color of the tongue?
Pale with thin white coating.
Pale red. Yeah, pale red or pink with thin white coating.
Pale red.
Slightly moist, so not dry, not too moist. Which of the following best describes the view on common patterns of imbalance?
They manifest in frequently observed signs such as pale, swollen tongue.
Actually, you see this a lot of times, 90 to 95% of patients, believe me.
It's common. Yes.
Diba? Yun. The diagnostic process itself is subjective. Which factor most directly introduces this subjectivity?
The practitioner's personal way of observed signs.
Okay. Which of the following best defines the term diagnostic pillars in Chinese medicine?
The collection of sensory observations, visual, auditory, olfactory, tactile, used to gather diagnostic information.
Which statement most accurately reflects the distinction between norm and common?
Common signs are statistically frequent, but may still represent an imbalance. A norm represents the ideal physiological state.
Which of the following factors influence the variability of a physiological midpoint?
Gender, age, season, and time of day.
Okay, number 2, right?
Yes, number 2.
Process in Chinese medicine is ultimately
the subjective due to personal weighing of signs despite objective observation.
Why might a practitioner place more emphasis on visual and auditory signs today compared to 10 years ago?
Because the practitioner has shifted personal diagnostic weighings over time.
Which diagnostic pillar is considered indispensable and likened? Okay. Yeah. What's the answer? Cornerstone.
Wait, what number?
Number 72.
Tongue diagnosis.
Yes. Do you all agree? Tongue diagnosis.
Diagnosis. Cornerstone.
So if you don't do tongue diagnosis, not good.
Yes.
We will teach all the patients how to look at their tongue so that the next time they look for an acupuncturist, they should only choose those who will know how to read their tongue, okay? Which of the following best captures the view on memorizing signs and symptoms versus understanding their physiological origins?
Understanding the physiological basis facilitates deeper diagnostic insight and reduces reliance on note memorization.
So it's really understanding, correct? Which statement reflects the relationship between common tongue appearances and normal tongue appearances?
A common tongue may still indicate imbalance despite its frequency.
Every sign and change is significant because
Each physiological change reflects a potential imbalance.
so everyone should know the difference between imbalance and disease, no? So what is the primary purpose of asking what should I expect to be seeing, hearing, smelling, or feeling right now during diagnosis?
To establish a baseline of normative sensory expectations for comparison.
Which of the following best illustrates that context defines the meaning of a sign?
A rapid pulse may indicate heat in one context but deficiency in another, depending on accompanying signs.
And we all know that we have such thing as empty heat, right? And we have excessive yang, no? Modern Western medicine focuses on less and less. This critique implies that Western medicine
Reduces the scope of diagnostic information gathered from the patient.
that's why you spend more, diba?
Yes.
Its diagnostic pillar is described as being especially pivotal, such that its omission would destabilize the diagnostic roof.
Tongue and pulse diagnosis.
Always tongue and pulse. The interrogative approach to diagnosis refers to
The systemic questioning of the patient about symptoms and lifestyle.
what is the potential danger of focusing too narrowly on an initial diagnostic thesis?
Missing alternative explanations that could be supported by other signs.
Which of the following best exemplifies the claim that the whole is more important than the parts in diagnosis?
Integrating tongue, pulse, inquiry, and observation to form a comprehensive pattern.
Correct. A roof is only stable if there are four pillars supporting it. Which of the following would be an incorrect analogy according to the author's reasoning?
The diagnosis based solely on pulse without tongue, inquiry, or observation.
Yes, this is true. If you just use the pulse and then you ignore all the other pillars, then that's also budol, okay?
Yes.
Which of the following statements aligns with the evolution of diagnostic emphasis over a practitioner's career?
Diagnostic emphasis may shift, such as moving from interrogative to visual auditory signs.
Physiological changes are described as manifesting through which of the following modalities?
Seen, felt, heard, and smelled.
Why might a practitioner consider a pale swollen tongue with teeth marks on the sides, a red tip, and a greasy coating as abnormal, despite its frequency among clients?
Because commonality does not equal normality, it still indicates an imbalance pattern.
Correct. The diagnostic process itself is subjective. Which factor contributes most directly to this subjectivity?
Personal weighing of signs by the practitioner.
Which of the following best illustrates a purely reductionist approach to diagnosis?
All of the above.
All of the above. Only asking without observing, no? Ignoring the context in which a sign appears, and over-reliance on laboratory data. A deviation can be too little or too much of a variable. Which concept from classical Chinese medicine does this most closely align with?
The yin-yang balance.
The diagnostic process should be kept open-minded. Which practice exemplifies this openness?
Actively seeking evidence that both confirms and challenges the initial hypothesis.
Correct. What role does intellect play alongside the sensory organs in diagnosis?
Synthesize interprets sensory data into diagnostic patterns.
Okay. Which of the following best captures the relationship between objective signs and subjective interpretation?
While sense and objective, their diagnostic significance is filtered through subjective practitioner judgment.
Quite often, there will be too little or too much of each individual variable. Which diagnostic principle does this statement reinforce?
The principle of excess and deficiency.
A practitioner who emphasizes palpable signs is most likely aligned with which tradition?
Japanese acupuncture.
In diagnostic terms, the concept linear movements away from a midpoint most closely aligns with which of the following?
Deficiency, excess spectrum.
Yes. Which of the following best illustrates the view that all information has a value in diagnosis?
Integrating a minor change in voice, timbre, with other signs to refine pattern identification.
Why is it insufficient to simply memorize signs and symptoms without understanding their physiological origins?
Understanding origins allows practitioners to adapt to novel presentations and avoid note errors.
A change in physiology will manifest in which of the following ways?
Through tangible signs observable with the senses.
Which of the following would be an example of a linear movement away from a midpoint in a diagnostic context?
A tongue turning from pale to deep red, indicating a shift from deficiency to excess heat.
Correct. Which of the following best illustrates the concept that the context provides a definition, not the object itself?
A rapid pulse may be signify heat, wind, and deficiency depending on accompanying signs and patient history.
Okay, correct. Very true, diba? You need to really be very good at diagnosing. Which of the following best describes the function of the practitioner's intellect in the diagnostic process?
To synthesize multisensory data into coherent diagnostic patterns.
Why is tongue diagnosis considered a cornerstone of its diagnostic column?
Because it provides a wealth of vision information that, when omitted, destabilizes the diagnostic structure.
Okay, so you always look at the tongue, huh? Because we are,
Yes.
yeah, we need to separate the boodle from the non-boodle.
We can diagnose accurately.
Eventually, all the people in the Philippines will know, diba? So why does my acupuncturist not look at my tongue? Like going to a doctor and then he did not check you, no? Which of the following best captures the relationship between physiological change and tangible signs?
Tangible signs are direct manifestations of underlying physiological changes.
Which of the following would be an example of a manifestation that the practitioner should compare against the norm?
the quality of patient's breath odor.
Yes. Fragrance aligns with the evolution of diagnostic emphasis over a practitioner's career.
Yes.
Diagnostic priorities may shift,
Yes.
reflecting experience and personal insights, such as moving from interrogative to visual auditor.
So you should balance both the interrogation and you know, actually, when you start asking questions, you already have an idea what the patient probably has. Okay, from the time that he gets in, and even the way he walks, you would already know. No. Why might a practitioner consider a red tip of the tongue as indicative of a specific pattern, despite the overall tongue appearing common?
Because localized changes can signal specific organs involvement even when the rest of the tongue appears typical.
Okay, what does a red tip of the tongue mean?
Heart, heat,
Heart, heart,
Part one.
heart heat, or fire.
Okay.
heart,
Congratulations, ang galing.
heart study.
Thank you so much. And
May isa pa.
next one. Oh, may
May
isa.